Convening experts to solve problems is a part of our overall mission, and that is why we have brought you all together today. This is a continuation of our series of COVID-19 town halls to engage the built environment. We've discussed what firms need to be aware of as they reopen buildings, mental health for employees and customers as they re-enter buildings and hotels that were used to house COVID patients and/or medical personnel, the future of design and construction, and today we're talking about healthy buildings and the effect on public health during the pandemic. Everyone is concerned about reopening schools and all establishments in a safe and healthy way. We believe it is essential that you turn to experts to review solutions and best practices and plan for the future.
So what I'd like to do is extend this conversation and ask a really specific question of what does a green COVID recovery look like for the building sector? And how can the green building sector think broadly to support transformative change and a just transition in this moment? So today we're facing 4 converging crises: COVID-19 pandemic, an economic recession, a climate emergency, and a social justice crisis. I want to talk about how all 4 of these crises interact with the green building sector and our work for a safe, healthy, and just built environment. When we think about the pressing challenges of safely reopening buildings, it's easy to think that it's simply a matter of space planning and systems design. But a just COVID recovery demands that we put this movement in a broader social perspective. So I want to begin the conversation with the recognition of the incredible momentum of the Black Lives Matter protests and the urgent need for systemic change to address racial injustice in this country. Public health is a powerful lens through which we can better understand these issues, work for change, and translate it into our daily practice as designers. We all know by now that COVID-19 is disproportionately affecting people of color across the US. Adjusted for age differences, the Color of Coronavirus Project found that Black Americans are more than 3 times as likely to die of COVID-19 than white and Asian Americans. Black communities are also more affected by climate change. The majority of fossil fuel installations are in Black and brown communities, who in turn suffer from environmental racism and the health impacts of pollution. 70% of Black Americans live within 30 miles of a fossil fuel-driven power plant, and Black Americans are subjected to the highest level of air pollution of any group in this country. And air pollution is, of course, a significant morbidity factor for COVID-19, meaning that it increases directly the odds of dying from this disease. When we think about the green economy, we also find that all throughout the energy sector, as well as the design and construction sector, underrepresentation of Black Americans who historically face high levels of unemployment and economic insecurity. In the Mid-Atlantic where I live, half of Black Americans are unable to pay their utility bills. Even before COVID, Black and brown children are more likely than white children to attend a school or live in public housing with unremediated asbestos, lead, unsafe drinking water, and poor indoor air quality. So I know that all of these challenges can be incredibly overwhelming. They are not a joyous and optimistic thing to talk about, and they're certainly not new problems. I also know that as an architect, many of us have long shied away from connecting these larger systemic problems to our daily work, or even in seeing our work as being aligned in solidarity with vulnerable communities who may not directly be our clients on projects. But it's an important time to dig into the underlying systems of power at play in our industry and see how some of the outcomes of COVID-19 pandemic and the challenges of reopening are deeply connected to the design and construction of the built environment. These issues are not someone else's problem, but at the heart of a green COVID-19 recovery, a just transition, and ethical design practice. So this reality should lead us to consider the kinds of investments that we need to make as a country, the kinds of jobs that need to be created, and the ways in which we might need to change how we talk about green buildings and sustainability more broadly to rise to our present challenges. So how do we seize this opportunity and assure that the resources spent on COVID relief go towards a just recovery? And what are some of the trade-offs that we might change and that we might face in the coming months? So I suppose I could use public schools as an example, as they're certainly on everyone's mind as September rapidly approaches. And while the CDC and BOMA and ASHRAE and the AIA have all released guidance on keeping schools safe and implementing social distancing, improved ventilation, clean conduct, hygiene measures, all of which we need to take in our schools, it's essential that we also understand the legacy of disinvestment that many public schools have faced, which makes meeting these guidelines impossible without significant financial support. Jamal Bowman, Congressman-elect for New York, has recently issued a recommendation plan to reopen schools that directly aligns with the Green New Deal for schools and with the green stimulus. Others are following suit across the country. Such plans call for establishing COVID education block grants and COVID facility reinvestment grants for public schools, and critically demand that these capital improvements are prioritized by population vulnerability and building condition. Investment is essential, but it also matters deeply how and where it's spent. As architects, engineers, building managers, we need to assure that building strategies that decrease the transmission of COVID-19 are also part of a long-term green energy retrofit strategy that moves all of our facilities towards low carbon healthy buildings. We need to communicate that many of these strategies for decreasing indoor transmission, increased use of natural ventilation, filtration, cleaning, etc., are also strategies that support improved indoor air quality, which has an incredible impact on improving physical health, mental health, and learning outcomes in our schools. We also need to make sure that these projects, especially those which happen quickly, are vetted for long-term health and resilience outcomes. We need to assure that building renovations are done with healthy, non-toxic, and durable building materials. We don't do our schools any justice at all if we simply fill them with redless chemicals and poorly designed fossil fuel dependent building systems. We cannot recommend materials or systems that can't be maintained over time. And we need to understand the full condition of our schools, including the perspectives of students, staff, parents, administrators, teachers, and broader communities. This is hard work, and retrofitting buildings to address COVID-19 while also expanding climate resiliency and equity is a hard job, but it's also a green job. One of the central concepts of the just transition is demanding that good green jobs flow directly into frontline communities that have been disproportionately affected by climate change, economic disinvestment, and social injustice. We need to build professional programs so that facilities reinvestment grants stay in the communities. One example would be a program to train unemployed youth to serve as building health and resilience surveyors, preparing assessments of facilities and identifying opportunities for upgrades similar to a residential green energy audit. We should participate in such work and promote it across the building sector. But this work also means addressing the racial inequity in our own profession, prioritizing minority-owned businesses, partnering with community organizations, and taking a hard look at discriminatory practices in our contracts, procurement, and construction processes. Such outcomes will arise when we think beyond the building as an object or as a design outcome and advocate for all building occupants and community members, not just our immediate clients. Rather than being overwhelmed by the interconnected crisis at our doorstep, we must work together to find levers of power that can make buildings a powerful mechanism for change. Thank you.
Steph, I think it's a great segue to ask you about ventilation versus energy. We have so much focus in our past decade or two on reducing energy, and now, of course, the discussion, and there are a lot of questions that we always get on our discussions through the NIBS community about ventilation. And so could you talk a little bit about the trade-off between energy efficiency and increased air ventilation related to what we've learned with COVID, and maybe talk a little bit about what you think will happen when schools and other buildings reopen? What are we going to see in terms of changes and impacts?
Yeah, thank you for that question. I've been getting that one a lot lately, and it's really tough, actually. I think one thing that's interesting and complex right now is that while I think we're starting to have quite good guidance about strategies that we need to implement in buildings to reduce transmission and to keep folks safe, I think that it's actually, when I think across building typologies, it's really not a a one toolkit fits all situation. So I think this moment asks us to really look closely at the existing conditions in buildings and assess what mechanical upgrades or what systems improvements or design strategies actually can move the needle the most. That's going to look different in really old buildings that have suffered from disinvestment than it does with new construction. It's going to look different in different parts of the country, in different climate zones, right? I think that one thing that's really critical and helpful is that I hope this is an opportunity for us to change our thinking from this sort of conflict between energy efficiency or energy use and ventilation rates to looking at carbon and indoor air quality, right? I think that when we look at, rather than having these proxies, when we actually look at the indicators that we care about, the occupant health and safety tied to indoor air quality and other measures in the building, and the actual carbon footprint or consequences for climate change on our building systems, our fuel sources, our grid, et cetera, it opens up a much more diverse range of strategies that are really going to help us out. And I think also help us get out of this fixation on energy efficiency versus climate change potential. So the last thing that I just want to throw out there is, I think is going to lead to some really tough choices is that actually in many cases, we might use more energy and we might need to. And I think that this is also an interesting time to really think about energy justice and to think about who bears the burden of our systems and choices and who actually should be expected to bear that burden of upgrading buildings and where we're going to need to spend more energy and more money in the short term, really supporting public buildings, public spaces, low-income housing, hospitals, critical infrastructure, and really understand that resource use distribution as something that needs to be recalibrated and more equitable, and that's something that we need to do in the short term. I think it's really spot on to say that we need to point as much at what's working is what's not working. And I think otherwise we do a disservice as building professionals in not being clear about the strategies that are useful and also how they can be implemented technically and effectively. And so I think that there's just, even though there's starting to be more and more guidance at a national level about what those techniques are, appropriate filtration rates, what kind of HEPA filters do we need in schools, what optimal humidity levels, et cetera, and we need more data. But I think there are also strategies that can be implemented. I think we also really need to underscore how so many of those strategies are completely consistent with and in line with lots of other positive social benefit, right? It is cost worth making. These are improvements that are worth investing in, particularly, since we've been talking about schools so much right now, but there's many other examples of that in our libraries, in our healthcare facilities, in our homeless shelters. We need to make these improvements and make buildings healthier, more efficient, lower carbon to deal with COVID. But also, if we do it right, the benefits of those improvements will persist and will make our buildings and also our communities more resilient. One more example that I think has been quite interesting to see from Philadelphia is we have last year, the city instituted a very interesting program that looked at heat criticality and how to really address inequities in our city around cooling and access to cooling and all of the public health crisis that really happens. The program was very, very successful, but it largely leveraged improvements to public infrastructure and services, libraries, community centers, pools. As COVID shut down those facilities, it really created some difficult and interesting conversations about how we maintain access. Similar conversations around nutrition and school lunch. I think it's really, really important as communities we understand all of the services that these institutions provide, that we figure out how to support the people that work in those institutions and really direct much, much more funding to those actual institutions themselves and make them real cores and hubs of the community.
It ties back to your comments, Steph, in terms of getting people to focus on carbon and not just on energy efficiency or energy use reduction. We had a few comments that folks would like us to drill down a little bit more to talk about specific building things that we can do. And so, Steph, I wanted to go to you next to first, if you could talk about funding. So schools that we've been talking about need to do specific things, or they have an opportunity to retrofit. How do they get funding to do specific things? I know you've worked a lot with Philadelphia public schools and probably have a bird's eye view of these issues.
So unfortunately, I don't know that I'm going to have a great answer. I think there is quite a log jam, a wall, a stoppage. I don't know. Things are not moving at the national level and the federal level. I think there's some real interesting proposals in COVID relief bills that are trying to push funding to schools. There is, as that continues to work its way through the education department as well as Congress, I think there are really quite a lot going on at the municipal level, and at the state level. So I think for anyone working on projects, it's really important to see what's happening through your state government, and also if you're in a city or in an urban area, try to understand what programs are being proposed or pushed through at your municipal and city level, and how to best support and advocate for those programs as well. So in Philadelphia, there's movement happening really to redirect funding to public schools, but also, like I had mentioned before, to really push forward this idea of doing quite focused building assessments that look both at energy efficiency, at health, and at addressing COVID needs. And it's a combined toolkit that can take on those three. There's also proposals for that kind of work in New York City and New York State that's starting to gain an awful lot of traction, even just in the last few weeks. I think, as has been mentioned, there are school boards and teachers that want to open, but it's really important that they not be forced to do so without being given the means to do so safely. And hopefully this at least is a moment for us to really talk seriously and with specificity, technical knowledge, and compassion about what is the context in which schools can reopen, as Dr. Allen was mentioning, but also what the state of those individual buildings are, and what real changes need to be made and what kind of funding needs to be unlocked. The last thing I wanted to mention is I think it's really important for architects and engineers or policymakers to advocate for both the building systems that we need in place, filtration rates, filtration quality, sanitation measures, hand washing stations, clean water dispensers, touchless entry, all of those specific things, but to also extend themselves to really think about building maintenance and ongoing upkeep and the staff that are really needed. There's a whole economic component to whether schools have nurses at all, whether they have adequate health staff to support children and teachers, cleaning staff, et cetera, et cetera. So all of that added burden of keeping children safe doesn't just fall on already overstressed teachers.
Steph, would you give us your key takeaways for folks to remember?
Sure. I think that, really two things I want to underscore. One is that we have a lot of work to do in terms of reopening and rebuilding trust. And I think that's trust that our buildings are safe, trust that our employees and teachers and healthcare workers are looking out for us, trust that our government is transparent and equitable. And I think that that is going to require a whole lot of collaboration and mutual support. I think that we need to identify what systems of power we can really advocate for and touch that can make long-term transformational change, and really see this as an opportunity and as a moment to uplift all people. I think that's yet another reason why an emphasis on and really casting an eye on the most vulnerable frontline communities is incredibly important, because we know that when we focus on those communities, we will actually raise up everyone. And that it is important and essential that we do that. And I think as designers, we have an incredible role to play. Speaking as an architect, we need to do a better job of explaining the links between public health, between economic development, between enhancing the economy and moving us forward to address this immediate pandemic, but also these much larger social and economic issues. Because we know we're critical to that work. If we believe that the built environment is important and that it has a profound effect on people's lives, we really have a duty and an obligation as an industry to see that through.
Okay. And